Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She is a very renowned gynecologist and obstetrician of Udupi. And she was a past president of Udupi IMA. And apart from that, now she is the present president of Gynecobi Society of Manipal. More than that, she is a literary person. She's been writing columns and also her book, the Vatsalya the Osuge. She won the best book award this time during the IMA conference. Dr. Shama Prasad Shrestha Kruti Prashasti. And congratulations, Dr. Rajalakshmi. We are very proud
Thank
of
you,
your
ma'am.
achievements. And
Thank you, ma'am. Thank you.
nowadays women are so worried and all the time stressed. Suppose the bleeding is more, they are worried. Suppose somebody says that ultrasound shows some fibroid or some thing, they start worrying, oh, whether it is a cancer or something. Now, worry has become the order of the day. And when we have so much of technology advancement, should they worry or should they not worry? And what exactly is this fibroid and why do they come to the doctor? Please tell us.
Surely, ma'am. Fibroid is a excessive growth of the muscular tissue of the uterus. Inside the uterus, the muscle mass grows in excess under the effect of estrogen and progesterone hormone. So that's fibroid usually presents with excessive bleeding, heavy bleeding which lasts more than 8 to 10 days, or heavy bleeding. Some people come and say we change pads every 1 hour. So in that way, heavy bleeding will be there. Or sometimes depending on the position of the fibroid, whether it is inside the uterus or outside the uterus, it can produce pressure symptoms. It can press on the urethra, the urine pipe, and there may be problem in passing urine or incomplete emptying of the urine.
Okay.
There can be
that means it
pressure
compresses on the surrounding tissues and then causes the
Yes.
obstruction. So
Yeah, when
motion
usually it is
passing
on the
also can be obstructed, urine also can be
slightly.
obstructed. Yes.
Yes. If it is lying on the outside, what we call as subserous fibroid. So when the fibroid is inside the uterus, it usually produces more bleeding and it causes anemia. The hemoglobin goes below 6 to 7 grams sometimes. So they'll have breathlessness, palpitations. Even on small work, they'll get very tired. All these symptoms can be there. So why does this fibroid happen? As I told, it is because of the actions of estrogen and progesterone. And it can be like hereditary. If the mother is having a fibroid, mother had a fibroid, the children can have, your siblings, sisters can have it. So there is some genetic defect which is related to this fibroid formation. Adding to this is the present day lifestyle, our decreased activity, which leads to obesity, and the food what we consume. If we are taking more processed food, more with red meat and less of vegetables and
that
fruits,
means eating
that also can cause.
Eating the junk food and causing obesity also can cause the fibroids. That's what you're saying.
Yes.
Yes.
Yes, it can cause the fibroids. Even our some of the habits, making smoking and drinking also, alcohol can also contribute to some changes in our genetics,
the women drinking
epigenetics.
has increased. Nowadays, women drinking and smoking has increased. And along with that, their infertility also has increased. They are unable to become pregnant. And the birth rate has come down to almost 1.4. And probably these bad habits and then the lifestyle changes of the modernization has got a very great impact on their motherhood.
Yes.
Is that
Most of these lifestyle alterations what we have done cause some genetic mutations which we called as epigenetics, and they are going to this they are landing up with all these diseases, non-communicable diseases in earlier age. Like fibroids, we usually used to say it is perimenopausal. After 40, 45, we used to get. Now in the even younger age group, 25, 30 also we get fibroids. Lady comes for infertility. She says coming and I am not conceiving. I want to know what is the problem. So when we investigate, we find these fibroids inside the uterus. So fibroids can also cause infertility. So there are various presentations of the fibroid. It can be due to fibroid as such or the pressure effect or due to anemia, which is a result of this excessive bleeding due to the fibroid.
Okay,
Yes.
okay. So that means,
Yeah.
either the mother that they have inherited, or because of their wrongdoing, they'll get the fibroids. Once they get the
Yes.
fibroid and they are not able to get children, or after getting the children they have, what are the options and how do you investigate and how do you manage these cases?
Okay. If they present, sometimes they can even present with some heaviness in the lower abdomen and they feel it has become tight, it's become little firm. So that may be a symptom also, mass symptom. So first thing we do is an ultrasound of the lower abdomen. It can be either through the abdominal route or through the vaginal route to see whether is there any fibroid, where is it situated, how many are there, and what is its relation to the endometrium. Endometrium is the innermost layer of the uterus. So that we see, that is through the ultrasound. In case we have a huge ones which is pressing on the kidney, the ureter, everywhere, we may not be able to see the full dimensions in the scan. So that time we need to do a MRI or CT scan pelvis to see the extent of the fibroid. So this fibroid, as I told, it can cause anemia. So we need to do blood tests to see hemoglobin. Sometimes peripheral smear also to grade the anemia and what type of anemia they have got. And sometimes in when we were students, we were taught what were the complications of fibroid. It can have some red degeneration, that is during pregnancy. The blood supply to the fibroid can come down and the inner layers of the fibroid can shrink, producing abdomen. So that is one. There can be age-related degeneration. There can be calcium deposition. But recently we have found that though we have been telling that it is a non-cancerous mass, it's a benign swelling.
Benign, but it
Yeah,
can become
benign
a
swelling.
cancer.
Cancer in 1 to 2% of the patients. So we call it as the leosarcoma. So to investigate that, we have to do some extra biomarkers like LDH, liver function test. All these tests have to be done. So basically, ultrasound is the diagnosis.
That means instead of doing the biopsy, you are doing the blood test and then get your suspicion approved and then go for the surgery. Okay.
Yeah. Yes.
Okay.
We do the more precise scanning or the imaging modalities and the biomarkers to see the extent and what is the possibility of them being a malignant ones. So those tests are done. Okay.
So your treatment depends on how many are there, how big it is, and whether it has become cancer or not. So depending on that, how do you treat?
Okay. Treatment depends on patient's age, whether she is desirous of having children, and how is her quality of life. If it is small ones and causing anemia and all, usually we can also give medical management. We can use some tablets which will shrink the fibroids, and the estrogen and progesterone has come down, the fibroid will start shrinking. If not, if they persist with the fibroid, we might have to suggest them surgery. So that can be either removal only of the fibroid, which we call it as myomectomy, or removal of the uterus along with the fibroid, which we call as hysterectomy. So when do we do myomectomy? If the patient comes with infertility mainly, she is desirous of having a child. So we need to preserve the uterus. So those small fibroids, which are hindering the implantation of the embryo in the uterus, that will be removed. Now, how do we do it? There are two ways. We can do it under laparoscopy, through laparoscopy, or through a hysteroscopy. Hysteroscopy is a endoscopy, which we are passing through the vagina into the uterus and we are scraping out that fibroid. So that can be done. And if it is big ones also, if they are in the perimenopausal age also, sometimes we do give the tablets. But if they are very anemic and they are tired, their general condition is not that good, not improving, we suggest them hysterectomy. Again, this hysterectomy can be done either by laparoscopy or by hysteroscopy. Now, they are almost menopausal and they don't want the uterus and there are multiple fibroids. That time, we advocate Hysterectomy. Hysterectomy can be done.
That means just remove the uterus. Yeah, whole uterus is removed. Okay.
Remove.
You remove
That
the uterus, or along with that ovaries also are removed?
Depends on the age, ma. If it is usually below 45, 48, we don't remove the ovaries, because otherwise they will go into surgical menopause. Their periods will stop. But those ovaries will function for at least 1 to 2 years afterwards. If the ovaries are healthy, we don't remove it. Below 50 years, we don't remove it. We remove the tube, because recent studies say that the fallopian tube is the one, the epithelial cells there are the one which cause all these our genital malignancies. So we remove the tubes, but not the
Tubes are
ovaries.
removed. Okay, okay.
Yeah, tubes are removed, but not the ovaries.
Ovaries, okay,
So,
okay.
so people might think that if it's the fibroid, it's a surgery. It's a big surgery. One big cut will be there in the abdomen. We have to lie down for 3 months. No, gone are those days. Yeah, no more. We do now under laparoscopy. Sometimes we can send the patient home that day itself. They can resume their activities, normal activities within 1 week or 2 weeks, and no need of lying down and all. And there is in foreign countries, they have even finer versions of treatment like HIFU and all. They use the ultrasonic waves to decrease the size of the fibroid. It is not yet available here.
Burn that, burn that place and then make it all right. Okay.
Yeah, because people there are more. They are like they want to conserve their uterus. They want to keep the uterus. But our Indian people, you always say, we suggest myomectomy, just removal of the fibroid. They say, do you give us guarantee that it won't come back? That we can't say. It can recur under the influence. Under the effect of estrogen, it can come back again. There can be recurrence. So here people want permanent solution. That's why we opt most for hysterectomy than the medical management.
Okay.
Yes.
Thank you so much, Dr. Rajalakshmi. In other words, in simple words, you are telling not to fear the fibroids, and at the same time not to neglect them, because they may become cancerous and become sarcomas in the future. The hysterectomy or the removal of the uterus, because there are ways of treating, preserving the uterus so that they can become pregnant. And most important thing that you have told is our altered lifestyle is causing the obesity and fibroids. So eat more fruits, more vegetables, eat less
Be
junk.
active.
Yes, less junk, and keep your weight healthy and
under control.
Healthy.
Move every day. That is the one.
Yeah. Movement all the time, be on the move.
Yes.
So thank you so much, Dr. Rajalakshmi. Thank you.
Thank you, ma'am. Thank you for the opportunity.